I call the member for Braddon.
Thank you, Mr Deputy Speaker. Mr Deputy Speaker, I rise today to put the Turnbull Government on notice on behalf of the Braddon electorate in the critical area of healthcare. At the July 2nd election, the Braddon community overwhelmingly voted in favour of better healthcare. They also voted to protect Medicare from the attacks being made by the Turnbull Government. On the day before the election, the Prime Minister promised that no Australian would pay more to visit the doctor. This was a complete and utter lie. It has proven to be a lie with the latest figures from the government's own health department. These figures show quarterly bulk billing rates in Tasmania have dropped in the June quarter from 76.4% to 74% at the end of the September quarter, the biggest fall in any state or territory in the nation. Thousands of Tasmanians are now paying more to see the doctor, and the silence from the Prime Minister and his Tasmanian Liberal senators has been deafening. At the last election, we had the three amigos who wanted to punish the community on healthcare. The Tasmanian community punished them because they were out of touch. And now it seems Senator Abetz and his three other Liberal Senate stooges are no different. The Prime Minister, Senator Abetz and these three stooges need to look no further than the East Devonport Medical Centre. The East Devonport Medical Centre is reducing bulk billing to general patients. This means struggling families are faced with an out-of-pocket expense just to see their doctor, as the centre winds back bulk billing. This centre explained to their patients that the reason is, and I quote, due to increasing costs along with the federal government freezing the Medicare rebate until June 2020. Families are being made to make the difficult choice between obtaining care for a sick family member, having that preventative health checkup, or putting food on the table. In effect, the freezing of the Medicare rebate to GPs is nothing more than a GP tax by stealth. The Prime Minister knows this, but then again, if you are snuggled up in a harbourside Point Piper mansion, you are probably out of touch with the needs of the average person in North West and the west coast of Tasmania. I can just see the Prime Minister ducking into the Double Bay Hotel for a Pimm's and lemonade, not a worry in the world, while the people in my electorate struggle to make ends meet, and thanks to the Prime Minister, paying more just to see the doctor. But it's just not me that says the Prime Minister is out of touch and has his priorities all wrong. In a recent letter to me from the Royal Australian College of General Practitioners, they wanted to make me aware of the success of local GPs, Dr Jane Cooper from Devonport and Dr Chris Hughes from Wynyard, in achieving major awards in that organisation. The college also tells me, and I quote, for a state with around 600 general practice managers, Tasmania has been overrepresented in national accolades this year, and Braddon, it seems, is leading the charge. Unfortunately, the correspondence goes on further to say, and I quote, we must now turn our attention to the continuing risks facing the health of the Tasmanian people. GPs across the country are still reeling from the open attack on general practice, the best evidence driver of preventative health outcomes, via the oppressive Medicare rebate freeze. And I continue to quote, nowhere is this being felt more acutely than in the northern suburbs of Hobart and the northwest, where for the first time in memory, struggling patients are being asked to pay out-of-pocket expenses for general practice visits. Mr Deputy Speaker, another consequence of the Prime Minister's GP tax is that people are being forced to present at the emergency departments of the Mersey Community or Northwest Regional Hospitals. This approach makes no economic sense, let alone the obvious preventative health benefits of patients firstly seeing their local GP. And on the Mersey Community Hospital, the only federally funded hospital in Australia, this week a delegation of Northwest Tasmanian mayors are visiting this place to try and gain some long-term certainty for that hospital. But the minister has repeatedly refused to give any certainty to the long-term funding for that hospital. So the end of the Medicare rebate is what's needed, and certainty for the hospital is also needed. Because I can tell you, Prime Minister, the people of my electorate will never forget And if you fail them on healthcare, they'll certainly will never forget.